Thank you, Julie. And we're joined tonight by Casey Carlisle, family nurse practitioner at Ferrell Hospital in El Dorado. Casey, we thank you for being with us tonight.
Thanks for having us.
Well, we appreciate you coming over. Are you seeing many patients with COVID symptoms at Ferrell Hospital?
Yes, we unfortunately do continue to see lots of patients, whether it's in our ER or in our respiratory building, that are coming in symptomatic and needing testing for COVID.
Do you suspect that's mainly because of the Delta variant right now?
Yes, particularly it's the Delta variant that we're seeing a spike in our cases, even more so among our youth that are back in school and doing social settings.
Are you also seeing cases of other respiratory illnesses in children these days?
Yes, this is the time of the year that we do see allergy in younger children, and we're also seeing an uptake of RSV in children also.
So now, if you're a parent and your child starts having some respiratory issues, what do you tell parents as far as knowing whether it's COVID-19 or whether it's just like allergy symptoms? What are some different variants there?
We always encourage families to bring their children or even adults to come in and be screened, be looked at by a professional so that we can go through conversations to see if it's allergy related, if we think this is a common cold, or do they need to be screened for COVID.
Okay, because all those things are happening about the same time these days.
Yes, yes, and it's very confusing for families. They don't understand what they should do, what kind of treatments they should be going through. So that's why we want them to work with their primary care provider or local health care setting to see if they need to be screened, tested, or what treatments can be offered for their families.
Great. Do you have a COVID-19 unit there at Ferrell Hospital?
Yes, we have a specific hallway that we put our inpatient COVID patients in so that they are not in like a general population with our regular patients, so that we're limiting exposure from. And then we also, for our clinic side, have a building outside, we call it our respiratory building, that we're seeing all patients that have any type of respiratory symptoms, fevers, sore throats, any type of symptoms that could be related to COVID, so that those patients aren't coming inside in our regular clinic and exposing those that have chronic medical conditions or more frail patients.
How busy is that COVID unit right now?
Our unit, we have a variation of patients fluctuating throughout the day. Our respiratory building, we are very busy during the day.
Now in that COVID unit, are most of the patients you're seeing there, are they unvaccinated?
Yes.
It's still, we've been hearing that for so often lately, is that it is now becoming more of a case of the unvaccinated who are having the symptoms that require hospitalization.
It is. We do have breakthrough cases in which people have COVID that have been vaccinated, and for the most part those patients are not nearly as sick, but for the most part our hospitalizations or the patients that we're having to transfer to other facilities that are in need of higher levels of care are those that are unvaccinated.
Now we've been hearing from some medical facilities that they're seeing more children with the Delta variant coming in and needing to be hospitalized. Are you seeing more children in your COVID unit?
Yes, we are. More children are being exposed, quarantined, or requiring hospitalizations now.
Okay. Are you seeing, compared to last year at this time, or back throughout most of 2020 with COVID-19, are you seeing more children with more severe symptoms?
Yes,
these days?
Those kids are sicker, they are sicker longer, they're experiencing more intense symptoms, and that's why we want those families to bring their kids in so they can be screened, we can get them tested so that we can quarantine and reduce the risk of exposure to other school-age kids or with social settings.
Now, what kind of treatments do you offer people when they do come into that COVID unit? What are some of the options?
Well, we're obviously screening and we're testing for COVID. We're offering screenings for strep, influenza. We're testing for RSV. If someone tests positive for COVID, if they're of age to get the antiviral infusions, then we look in to see if they're a candidate for that to help decrease their symptoms so that they're not as sick.
And then if you have to send somebody who needs ventilation, be on a ventilator because their symptoms are so bad, then you have to send them off to another regional hospital, correct?
Yeah. So we're trying to work with other hospitals to give that higher level of care if we're not able to keep those patients here. But unfortunately, all of the hospitals in our region, in our tri-state area, they're full because they're full of COVID patients. So sometimes we're having trouble getting those higher level care needs assessed and treated at another facility.
That was going to be my follow-up question to you. Just how hard is it to find a bed for these patients that are so sick?
It is extremely hard. We are having patients sit in our ER for hours to days before they are getting transferred and sent to another facility. All the other hospitals that have ICU units, they're full from COVID patients.
Which also presents a problem when there are patients with other needs that must come into those ICU beds.
And that we've seen that happen in our own small town hospitals, that patients that have heart attacks, strokes, or pneumonia that's not related to COVID, trauma cases, they're not being hospitalized at other facilities and they're having to stay in their local smaller hospitals because there's no beds available for them.
You and your staff, you're on the front line of this COVID battle, and it's been such a long battle. What kind of impact is it having on your staff?
The staff is tired. They are exhausted from trying to work, take care of COVID patients, take care of the other patients, but our staff stay strong. They want to take care of people. We're invested in caring for our community, but we want to reach the community to try to promote vaccinations, to promote quarantining if you've been exposed or you have family members in your household that are positive. That's the way that we're going to try to prevent and reduce our rates of infection here in Southern Illinois.
I know a lot of medical workers are just amazing people. This has been put an added stress on them, and they're still answering the call.
Yes.
So if you have a message for our viewers right now, because this battle has been so long, and I know a lot of people are growing weary of hearing the things about wearing a mask and getting vaccinated, but what is your message for people as this battle continues?
We understand the public's frustrations. They are very frustrated about having to wear masks. Everyone is, healthcare workers, the general community, but it's our part to try to help prevent infection rates from going so high. The Illinois Department of Public Health metrics are for us to stay below 8% 7-day rolling positivity rate. Our Region 5 is not below that and have not been below that in quite a long time. And we want people to get vaccinated and go talk to your healthcare providers about the risks and benefits, what's going to work best for your family, and choices for vaccination.
And so the battle continues, and everybody needs to continue to do their part.
Yes.
All right. Casey, thank you for joining us
Thank
tonight.
you.
We appreciate you being here. And we will have this interview and much more information about COVID-19 on our website, WSILTV.com.